You can stretch your legs for a cause this morning at the annual Stomp Out Stigma 5K walk at Grand Valley State's downtown Grand Rapids campus. The walk looks to raise mental health awareness and also fight the stigma surrounding it. It is free to join, and if you donate $100, it gets you a Stomp Out Stigma t-shirt. Start time, rain or shine, is 9:30 this morning. And that takes us to this weekend's conversation. And I first asked the founder of Be Nice about the biggest myths their team and the community are working to debunk ahead of today's walk. And
embarrassment and shame that comes with the illness. And so also the fears that go along with it, that I might lose my job and may be treated differently if I got help. People may think I'm a bad parent if I went and got help. So those are the things that keep people from getting help and assistance when they might be struggling. The really sad piece is when you are stigmatizing on yourself, not willing to go get help, and then really things can begin to unravel. So if I go and seek out treatment and help, people are going to think that I am a weak person. I am a weak parent. If people go ask for help, it could be that stigma that goes with socioeconomic. If he would just get his stuff together, he'd be a successful person in a profession, or he could go get a job. So what people don't realize is those risk factors that enter into people's lives that can contribute to someone having mental health challenges can lead to someone struggling even worse than it would have been if they would have gone earlier.
Suicide prevention, another issue that this walk helps raise awareness for. So how do you and your team and your partners help people spot the warning signs in advance so that they can speak up and get those help?
It's notice, invite, challenge, empower. Notice the signs and symptoms, notice risk factors, become educated, gain knowledge, so then you can invite yourself into a conversation. And that's sometimes, David, where people don't know, how do I jump in? How do I even start a conversation about mental health? They're going to be angry with me. They're not going to listen. It just takes one step in. I've noticed this. This is what's different about you. What's going on? I may even know that this person is going through a boatload of challenges. Those are risk factors. I'm going to jump in. I know you're going through a lot right now. Can I help you with anything? So we, as a community, we're going to work together.
How do you and your team, your partners, everybody behind this effort try to get education on mental health as accessible as possible to those communities that are often overlooked and probably won't be able to afford any care to address any mental health issues that they may have?
We have an online pledge, and people can click it, and in 12 minutes, you can learn the action plan. We go through noticing risk factors and noticing signs and symptoms. How do I start the conversation? How do I challenge others? How can I challenge resources? So we have an online ability to find resources in our community, but we at all times will pick up and have conversations all the time.